Hi everyone, my name is Tonga Zakharowska and today I have prepared a presentation for you all about injury recovery timeline. This is my final project for our sports medicine class, so let's take a look at it. So for my case study, I chose a high school track and field athlete who was participating in a season event when she was sprinting in a 100 meters race, and halfway through the race she suddenly clutched her hamstring and started limping and was unable to continue. So in this case we have a high school track and field athlete. It's around 15 years old female who is experiencing pain in hamstring after around first 50 meters she ran, is limping, unable to run, and we are suspecting a hamstring strain in this case. Hamstring strain is a common injury in sprinting athletes due to the high eccentric overloading during the sprints. When athletes are running fast, the legs need to swing very fast as well, and then the muscles lengthen and shorten very quickly. In the high velocities in the sprinting, muscles then undergo very quick eccentric contraction in the late phase when the leg is swinging, and this increases the risk of the tears in the muscle fibers, such as these athletes have the hamstring strain. So emergency care is right after the athlete grabs her hamstring and is unable to continue. From the physiological standpoint, there is a tear in the hamstring. We can see it on the picture, our leg, our hamstring, and the muscles. So we have a tear in the muscle fibers of the hamstring, along with damage also small blood vessels that are overall causing the bleeding and the inflammation in the area. In this initiates the first inflammatory phase of the healing. Athlete notices pain, has decreased strength in the leg, general function of the leg is smaller. Also, the range of motion is not as big as can be, and we can feel the pain. There can also be a swelling, and athlete can notice also the tightness. Athletic trainer in this case is very important because the athletic trainer should run and go help to athlete right after this happens, should quickly evaluate the injury, helps athlete to get off the track, and then help with the applying the police principle, maybe helping with some further evaluations in the next steps, and just helping the athlete to feel better, help with the pain, try to figure out what's going on with the leg. Coach should remove the athlete from the competition. If at this point there is also a physician at the race, it can happen. The physician can also help with can help trainer to assess what happened, what's going on, and try to help the athlete as much as they can. And in the further stages, we are going to do more evaluations, and then we are going to apply the police principle, which stands for protection, optimal loading, ice compression, and elevation. So the next stage is our clinical evaluation, which should occur within 1 to 3 days, 24 to 72 hours of the injury. And here the team physician assesses the strength, symmetry test, range of motion, can palpate the hamstring to assess how severe this injury and how severe the muscle fiber disruption is. Physician can also refer athlete and order more of imaging, such as ultrasound or MRI, to be able to visualize the injury better, to see how much there is a muscle tear, and this can help assess if this is grade 1, 2, or 3 of the muscle strain. The grade 1 is mild strain, minor fiber disruption. The grade 2 is partial tear with moderate function loss, and the grade 3 is the most severe. There is a complete tear in the fibers, and athlete is not able to function very well with the leg. And based on the findings and the evaluation from, for example, MRI, or maybe the tests for range of motion or strength symmetry tests, physician can create unique personalized treatment plan for the athlete to help manage the pain, determine if the control loading is appropriate at which phase, and can refer athlete to the physical therapy as well. The athletic trainer is helping assisting athlete by coordinating the appointments, helping with the rides, monitoring for any symptoms, maybe increase in pain, decrease in pain, swelling, helping manage the pain, and make sure that athlete is taken care of and is following the treatment plan from the doctor. When we are doing the treatment and the management, from the physiological standpoint, this is inflammatory phase where body is clearing damaged tissue and the scarce tissue is being formed. Athlete in this phase, similar as on the previous phase, has limited physical activities based on the results. There is no eccentric loading or excessive stretching. Athlete is working with athletic trainer or maybe even physical therapist doing the treatment, but basically the athletic trainer is most responsible for the treatment, helping athlete with the pain management, and we are using the police principle, so we are using the ice therapy for, I don't know, around 20 minutes every 2 to 3 hours to help reduce the inflammation and swelling. We are using compression. Athletes can wear some band or wrap to limit the swelling and also to squeeze the hamstring a little bit to provide a little bit more of a support. The leg should be elevated so the fluid is not being pulled with gravity down, but and increasing the swelling, but is lifted up. Athletes should have a protection, activity modification, and should stress as least the hamstring as possible to allow for the healing, but also should also be able to do the daily activities as much as they need to. And maybe very light stretching, knee flexion movements, if it doesn't increase pain, can be done with the supervision of the PT or the trainer. When athlete is in a lot of pain, trainer can help athlete, give them Tylenol, for example, for the pain, but also ibuprofen can be a great option for both pain and inflammation. And trainer helps with whatever athlete needs, whatever treatment, to oversee the treatment, to help with the tissue healing. Athlete can give athlete a soft tissue massage to help with muscle spasm. They can also do laser therapy or ultrasound to help with soft tissue healing, or if the pain is very severe, TENS is also a great option to temporarily reduce the pain in the area by using the electrode on the leg. And from the treatments and to help athletes feel a little bit better and promote the tissue healing, we are going to transition into the rehab phase. And we are going to be performing structured exercises. So in the rehab phase, athlete is very important, is progressing, is not thrown into the pond to swim, but it's progressing from simple to more difficult and more harder exercises. Physical therapist is here to help athlete to do the plan and create and perform the exercises. We are doing the strengthening and mobility exercises with a therapist, athletic trainer. From my own experience, can be involved as well. A lot of time, athletic trainers have a lot of experience, and if the injury, especially, is not that severe, then they can create a great rehab plan as well. But since this injury is more severe, our athlete is going to be working with physical therapists to ensure the proper movement and to make sure that she's not progressing very fast, or she is causing maybe even more damage. So the PT is going to be a very important person here. And from the physiological standpoint, we have a proliferation phase when the new muscle fibers from the scar tissue are starting to remodel, and athletes may feel a little gradual increase in tensile strength. A physical therapist is overseeing the therapy. Athletic trainer is overseeing the therapy, and the physical trainer is leading the exercises, the rehab. You can see here on the right side on the picture some stretching. Athlete can do a lot of different exercises. We are progressing through different phases. We are focusing on the flexibility, neuromuscular control, and eccentric hamstring strengthening. And this phase is basically done to help athletes feel better, get stronger, be able to do whatever they need to do during their life, and get them maybe even stronger than before to compete and practice again. So here are the couple steps of the rehab. The first early rehab is focused on the isometric phase. The goal here is to reduce pain, maintain the muscle activation, to prevent atrophy, but without stressing the tear and causing more pain or more troubles to the athlete. We can do isometric hamstring exercise, for example, laying on the stomach, bending the knee, and just gently contracting the hamstring without moving the leg, so the muscles are getting engaged. We are doing just 3 to 4 sets, maybe 10 reps. We can do 1 to 2 sessions a day. It's very important that during the rehab, it needs to be pain-free, and athletes should stop and ask if there is any pain. We can also do in this phase, early phase, range of motion for hip and knee exercises. We can do also a core for planks and dead bugs. The next phase is coming to the concentric phase, and concentric strengthening phase. We are building the strength without overstretching or overstimulating the injured muscle fibers. We can do prone leg curls with maybe light ankle weight or resistance bands, some glute bridges to strengthen the glutes and hamstrings, or standing hamstring curls with maybe a resistance band. We are doing maybe 2 to 3 sets for 10 to 15 reps, and we are doing 1 session every day for 4 to 5 times per week. Important, it needs to be again without any pain. If athlete is doing good, no pain, is getting stronger, we are progressing into the eccentric training. This is to prepare the hamstring for the sprinting again, to remodel the scar tissue fibers that are in the line with the muscle stress, and to make sure that the athlete is going to be able to sprint maybe even faster than before. We can do Nordic hamstring curls, single leg Romanian deadlift with light weight. We can do Swiss ball hamstring curls. These exercises all should be very slow, very controlled, focusing on the eccentric contraction, eccentric portion to feel the lengthening of the muscles. Then we are also going to incorporate our 4 stages, the flexibility and neuromuscular control during the rehabs, to do gentle hamstring stretches with no or very mild tension. We can do PNF stretching. We can do dynamic warm-ups, dynamic high knees, leg swings, for example, if athlete is already progressing through the final stage of the rehab. We can do balance for single leg, stand on a foam pad or bosu ball, maybe using some hurdles for different drills to promote the stability and the proprioception. And we are doing of the flexibility, just couple sets, couple reps, maybe for 10 to 15 minutes every day. And then when athlete is feeling good, is progressing, we are moving into sport-specific drill, which is our latest phase. And we are basically preparing the athlete for sprinting and competition again before she's fully cleared for the full practice with her team. And we can do different stride exercise, just 50-60% effort for short distance, acceleration drills, cutting agility drills, and we are increasing distance and repetitions of this set gradually. So at first it's very important to monitor for the fatigue and maybe soreness, and then when the athlete is doing good, feeling good, we can do maybe a little more of distance or maybe a little bit of higher effort. And after the rehab, if the athlete is doing good and progressing good, we are going to do re-evaluation phase with the physician. Physician is going to test functional abilities of the leg, the strength, range of motion, sprinting drills, the symmetry in the hamstrings, and if the movement is pain-free. And from the physiological standpoint, there is still a risk of re-injury, and risk of re-injury is still going to be here. Once there has been an injury in something, there is always going to be the risk. It can be lower, it can be bigger, depending on what we do. But physiologically, the tissue is in the remodeling phase. It's getting stronger and more organized. So it's more and more ready. And PT and athletic trainer, health physician, during the testing, physician can clear the athlete if there is a good progress, there is no swelling, there is no pain, athlete has good symmetry in the range of motion, the flexibility, and the strength, very importantly. If we see, though, some pain or swelling, we can progress to, again, having done an MRI, for example, or ultrasound, to see how is the athlete doing, and doctors and sports medicine team is going to re-evaluate why the athlete is still experiencing some troubles, is not feeling the relief as much as they should. And hopefully this is not the case, and hopefully our athlete is feeling good, feeling strong, and is cleared for the practice. And then we have the return to full participation, where coach is working with athlete again. The strength coaches are still focusing maybe more on the hamstring specific exercise, communicating, very important, with trainers, with the doctors, what to do, maybe different exercise for the athletes, or if to throw maybe one more set or a couple more reps of certain exercise. The tissue here is almost fully healed, but it's still remodeling. So we need to strengthen the muscles, so athlete can work either with a strength coach or may still go for some treatment or some rehab exercise with their PT or athletic trainer, more likely, probably so. And athlete with coach needs to communicate also with us. Coach needs to communicate with the doctors and with the trainer to maybe do some modification for the gradual sprinting training and the sprinting progression. It's very important to monitor for the fatigue and the soreness to see how the athlete is feeling and to prevent the injury, and an athlete is going to be ready to be maybe even stronger than before and compete. So special consideration, we have high school track and field athlete who is still very young. She's still maybe 15, maybe 16 years old, so she is still, her body is developing. And we learn in the modules that there is difference in approaching the athlete who is still in development and athlete who is fully developed. So the prep recovery here is more than a rushed comeback, because youth is when youth is training and working out, playing sports, it's very important that they are playing it for their life, to be athletes for life and not just athletes for the school or for the results, but athletes for themselves. So it's very important that when we have an injury, for example, the hamstring strain, that the athlete is properly recovering, maybe making rather smaller steps forward at a time rather than taking one huge step and forgetting on a lot of small things that may then cause either re-injury or can slow the athlete progression or can even interfere with daily life, which we definitely don't want. And every individual is unique. Every athlete is its own individual, especially when we are talking about track and field. So it's very important that coaches understand that and can maybe differentiate the plan for the athlete after the injury during the practice from the other athletes, or the trainers can help with that as well. And in the whole process, when someone gets injured and the injury is maybe more severe or taking a little bit more time than maybe 1 to 2 days, the sports psychologist is very important because they can help athlete to find coping strategies to cope with the stress, maybe the pressure from either parents or maybe the coaches or maybe their own expectations, to understand that their body and their health is the priority, and the great performance is coming next. And this is very important, especially for the athletes who are putting too much pressure on themselves from the athletic standpoint and want to be very good. So the sports psychologist can help them to find a balance and make sure they focus on their health and their well-being first. When we are dealing with the hamstring strains or any injuries, it's the warm-up, the sport-specific warm-up exercise before the sprints are very important. Also, the athlete should be rested very well, should have good nutrition, good hydration, and we can, for example, do hydration tests to assess for the hydration, and athletes need to take good care of themselves even when they are very young, but their bodies and their muscles need to be 100% ready to prevent the injuries and to perform very well. So I think from my own standpoint, I really enjoy this project because as an athlete who has been through a lot of appointments and a lot of MRIs and X-rays this school year and a lot of appointments with doctors, this was great for me to see in the all class how trainers and doctors approach athletes and why they do some things they do and what is the order of it. And also from my own standpoint, it was like, oh, okay, now I can understand why they did that. But so I can understand maybe both sides better. And I really like that we were progressing throughout the course from who is a sports medicine staff, what they do, to different smaller maybe injuries, maybe more acute injuries. Then we were talking about the rehab program, about the management, the rise in police, for example, different treatment modalities, and this very, I don't know, holistic approach, what it takes, not what it takes, but what sports medicine includes and what it takes to be an injured athlete maybe, and why is it how it is. And I can see that at Tulane we have a great sports medicine team, and I'm very lucky to be working with people that are working with me, because they are definitely following all of the everything we have learned in the course. And it was also for me for example, I had a concussion, so when we were working about the concussion project, I was able to blend in my own experience with what we learned. So it was easier to connect. And I really enjoyed it, and I learned a lot about the differences in athletes in the ages. I think that is very important, and I really enjoyed also the last module we were doing when we were not talking about how to treat acute injuries, but how to prevent them even more, because I think that's a big part of it. Because sometimes when you injure yourself, you can heal. Sports medicine stuff can help the athlete to get back, but the function of the knee or the leg or the arm may never ever be same as before. So I think the uh, doing prevention is very important, and educating people, also having people communicate from the sports medicine standpoint is very important. For example, in this case, when we're talking about the young athlete who is still in high school, it's also very important that the parents are know what's going on, and they know that their child got injured. They know what are the next steps, because I think in this age is also a lot of mental pressure that athletes is trying to figure out their identity. And when they get injured and they have good relationship with their parents can help them understand that it's okay to step back for a little bit or take it a little slower at a time, and they can find the support also at home, which is also then from physical but also the mental perspective very important. So it was a great class, and I really enjoyed this project to see that making small steps at a time is more important than trying to overstep the small steps with one big step and then be a little bit behind or uh, suffer with athlete's own health. So here at the end, we have some of the sources, and I hope you enjoyed the presentation, and thank you.